These are the details of the centre's oxygen SOP, a fully functional oxygen plant. This is what the centre has written to the states at the moment. Regular mock drills of oxygen plants as well, because we want to be better prepared this time for any eventuality. Uninterrupted oxygen supply chain. Adequate inventory of oxygen cylinders is also what the centre has mandated from the states, that they better maintain an inventory of oxygen cylinders. Robust refilling system to be maintained. Again, this is another prerequisite in order to be better prepared for any sort of a situation if, God forbid, it were to occur. Availability of functional life support systems, extremely critical. Again, something that the centre has written to the states to be, in fact, prepared for. Functional life support systems, oxygen control rooms to be restored as well. Again, a mandate from the centre to the states. Onboarding of all healthcare facilities. We do not want to leave anything to chance anymore. We faced the brunt of it in the past, during the past onslaught of the COVID-19 pandemic. Daily oxygen demand and consumption to be monitored. So we have to keep an eye in case we're falling short anywhere in order to ensure that those gaps are covered as well. Milan Sharma, my colleague, is now joining me live on this. Milan is, of course, covering the Health Ministry for us and all the measures that are being taken by the Health Ministry. Milan, certain SOPs that have already been put in place in terms of the advisory that the centre has sent the states. Clearly, while of course not trying to spread any kind of panic around the pandemic and its surge in China, etc., and the effects of it across the world, we do want to be better prepared, because we have borne the brunt of not having enough medical oxygen in the past.
No, of course, the government wants to be better prepared this time because of the widespread criticism also that was done for a country like India that was not able to handle that kind of pressure that happened. We could see lines outside the hospital, queue of people, sea of people gathering, dying outside hospitals also because of lack of beds and amenities, and especially oxygen during the second wave. But from the third wave onwards, there has been better preparation in a country like India as well, and which is why mock drills will be organized a synchronized way on Tuesday next week. That is what the Health Minister has discussed with the state health ministers as well, to make sure that there are PSA plants that are functional, operational. The kind of money that has been given by the exchequer or the central government to the states to be utilized is also have been discussed. And of course, we're going to look at the bed situation in each and every hospital, whether it's a non-COVID, COVID bed, and what would the kind of emergency services be at that moment when we are talking about, looking at the prerequisite number of beds that are required in each and every hospital. So all that has been discussed by the Health Ministry. And of course, with the mock drills happening in a synchronized manner, we'll also have this live drill that will happen on Tuesday. Of course, regular discussions are being done, and at the moment, of course, at the international airports, RT-PCR testing has been made mandatory for a few countries there, including China, South Korea, Japan, as well as other countries like South Korea, Japan, China, as well as Thailand.
Right.